Again to Doc Talk Live. This is another sort of impromptu Doc Talk Live. One of the things I like about this medium, Meg, is it does give us the ability to tackle subjects as they come up. I'm with Dr. Gilmer again. She was with me 2 weeks ago, and we were talking about Tua's ankle sprain.
Yep.
And now, unfortunately, we're talking about Tua again, about his hip injury.
His hip injury, yes.
So tell us a little bit about what happened this weekend to Tua's hip.
So for everybody that didn't see the video, all 5 people, I guess, in Alabama, what happened was Tua was getting tackled and two defensive linemen landed on him. And the position of his knee is what's really relevant here. So if you remember, his knee was flexed, so he was bent up at 90 degrees, but his hip was also adducted, meaning it was coming across his body. I guess the best way is across like this. When you do that, it puts the pelvis in a very vulnerable position where the hip, the bone, the femur can actually come out of the socket. And when it comes out of the socket, sometimes it doesn't just easily come out of the socket. It takes the back wall of the socket with it, which is the posterior wall fracture that they're talking about. You can see it a little bit better when you take the femur out. So if this is looking at him, this is the front, this is the posterior wall, and he knocked off a piece of that wall. Now, the size of that piece determines what happens. If it's a very small piece, the hip is stable when you put it back in and you don't have to have surgery. But if it's a big piece, you can put the hip back in, but it doesn't want to stay because it's not in a socket anymore that's tight enough to hold it.
So you've turned the hip into a shoulder.
Pretty much. And that's not good when you're playing football, as you can imagine, or even just trying to walk. The hip can actually wobble in the socket at that point if there's not a good fit.
So again, it had the injury occurred because his knee was flexed and his femur was adducted, and that position leaves the back of the hip vulnerable to that type of injury. Now, that's got to be a very rare thing to happen. How often does somebody in football suffer this type of injury?
Very rare. And for folks in Alabama, probably the last time it happened, people will remember Bo Jackson, and that's been well over 30 years ago that he dislocated when he was playing in the pros. His was a little bit different mechanism, but it's the same end result. He dislocated, and then he popped back in on the field. He actually did it himself. His muscles were strong enough it pulled it back in. No one reduced it for him. Tua's was a little bit different. It was still out when he stood up, and they put it in when he went back to the locker room.
With Bo Jackson, I always thought that Bo Jackson had circulation issues in the hip.
So that is actually a potential consequence of a hip dislocation. So the blood supply to the femoral head comes from 2 places. In adults, most of it comes from the capsule that surrounds the joint. In kids, it actually comes through an artery that goes into the ball itself, into the head through the hip socket. The problem is when you have a big injury, you tear the capsule potentially, and you tear what's left of the blood supply that comes from the socket. So you can get true blood supply issues to the femoral head, which is what ended up happening to Bo Jackson. The thing is back in the 80s, we didn't have MRI, and we didn't have a good way to find out early what was going on, and so he didn't find out what all the damage was. He just knew it hurt for years. He just kept trying to push through, and then by the time he saw
Bo Jackson dislocated his hip in the posterior wall area.
He did not. He did not. He had a pure dislocation, as best as we know. Again,
not necessarily a fracture,
correct,
like Tua had, but Tua is at risk to have
the same complication. It's a little bit lower risk when you take the wall out with it, because the hip doesn't have to come around the wall. It just went straight back. So there's somewhat less of a risk.
So again, the recovery. I mean, Bo Jackson, he made it back to professional baseball, not football.
Right.
Ended up with a hip replacement.
Very early.
But what is the prognosis here?
So, as I'm sure people have heard, he's headed to Houston to be evaluated. And not that I'm privy to all of this, so but my assumption is he's being seen by the traumatologists there to talk about surgery to fix the posterior wall because the fragment's too big to leave alone. What that entails is an incision going kind of starting on the outside of the hip and extending around, and you have to split some of the muscle to get it out of the way, and then you have to lift some of the muscle up off of the pelvis so that you can put a plate and screws to hold the wall in place. You're non-weight bearing for approximately 3 months, so he's going to be on crutches or in a wheelchair because he can't even use like a knee scooter with this. Like, it is not putting weight on it, because if you can imagine, if you're putting weight, you're pushing that repair, you're damaging it potentially. So he's got at least 3 months of pretty much complete rest ahead of him in a lot of ways. And then as he starts getting back after 3 months of not walking, he's going to have to learn how to walk before he can learn how to run, before he can learn how to do everything else again. And your body takes a while to come back from that. So his odds of going to the combine this year and performing at the combine are pretty much gone.
People may not be seeing this now. They might see it on the rebroadcast. So if you've got questions, hopefully I can get Meg to help us answer them. Is there anything there, Blake, that we need to address right now, or are we good?
No.
Okay.
What's the likelihood that, obviously not knowing all this information, what's the likelihood that you think that he'll see the football field again in his career?
I think it is very difficult to predict. The NFL, or even at Alabama and at the NFL level, they have some of the best trainers in the world available, best therapists, the best physicians. So if anybody's going to be able to get back, it would be a professional or an almost professional athlete. However, there is a lot of damage that goes into having to do this surgery in terms of your muscles, and it really depends on how he recovers his hip strength after the fact. The other thing to think about is, that wall fracture is the joint, and so you now have a fracture through the joint, and he is going to at some point have arthritis there, whether that's 2 years from now or 50 years from now. We won't know until it happens, especially in a professional athlete. There's a lot of wear and tear, so he may have, if he does get back, he may not have the 20-year career that we all wanted for him.
Why don't we leave it there, Blake? And if there's questions, people can type in. And again, this is Doc Talk Live. I'm with Meg Gilmer, orthopedic surgeon who specializes in foot and ankle.
Yeah.
But I appreciate you taking the time to do this,
Absolutely.
Meg. Thank you.